So let's get going. Here's what I do. I'm the editor-in-chief for various medical journals, and I've published over 100 studies. I have chapters in medical textbooks. I've lectured at 6 different university medical schools, and I'm a fellow of the Royal Society of Medicine in London. So when you hear an expert, ask them what their credentials are. Here are my credentials. And of course, for solving problems caused by toxins, the first thing is to detect the cause. Second is to remove it. And third is to repair the damage and the person's health is restored. So indoor mold spores cause inflammation and an immune response. But if you're chronically exposed to molds, these induce and cause chronic inflammation. And we know that the spores from fungi, toxic molds, contain mycotoxins. And mycotoxins from these spores are absorbed by the respiratory tree, not the gut, what you've been reading in some websites or Dr. Google or Dr. Facebook. It's in the respiratory. And then they go to other places causing systemic effects. As you can see, this has been known since the 1980s. So molds always produce toxins, and those are known as mycotoxins. Toxins are molecules, okay? So molds are always present in homes or workplaces that are water damaged, and they're always producing these mycotoxins. And it's much more common than we think. In the United States, 85% of the buildings have had past water damage, and 43, half, have current water damage. So it's pretty prevalent. A mold that produces mycotoxins produces a bunch of mycotoxins, not just one. It's not Aspergillus gives one, no. And by the way, there's 250 types of Aspergillus and of all molds. So one mold makes many mycotoxins. And if a mold known to produce mycotoxins is present in a home or a building or an indoor environment, then the mycotoxins it produces are present as well. Let's look at size. Human hair is 100 microns thick. Spores are 2 to 4 microns. Mycotoxins are 0.1 microns, the same size as a COVID virus. So all these air filters you're reading about, they do not work for this. This is what, if they would have had them all over the planet during the pandemic. So again, exposure to mycotoxins mainly by inhaling and then absorption through the skin. Ingestion through the gut is negligible. This is from studies. Now, this inflammation causes a lot of problems. It causes cancer, cardiovascular disease, Alzheimer's, diabetes, arthritis, autoimmune disease, neurological disease, and of course, lung disease. And there's an epidemic of autoimmune disease now in the United States. This is well established for years. If you can look at the bottom, this is the study that showed that, and it was published in 2017, 8 years ago. The frequency of autoimmunity in the US over the past 3 decades has been rising at an astounding 8.8 average annual increase. And in a recent review of the subject, researchers summarized the situation as follows. Taken together, the number of people suffering from autoimmune diseases is about 24 to 50 million Americans. This is 8 years ago, so there's more now. 16% of the US population. So to put it into perspective, autoimmune disease is equal to heart disease and cancer disease combined. So let's go on to the next slide. Mycotoxins trigger chronic inflammation and autoimmune disorders. This is from this study published a few years ago. And as you know, I always put studies. I don't rely on some guy talking on a website. I rely on medical evidence. How about autoimmunity and biotoxins in sick building syndrome? This is POTS and chronic fatigue syndrome, and autoantibodies are linked to mycotoxins. This is a study that was published in the journal Antibodies in 2020. And here are two more studies that showed that POTS is associated with autoantibodies and chronic fatigue syndrome as well from these studies. Let's look at one particular mycotoxin that is part of MyMycoLab's panel of 14 different mycotoxins. In this study published at Rutgers University in New Jersey Medical School, it demonstrated that gliotoxin causes demyelination leading to multiple sclerosis. And I can tell you, I've treated many, many patients with multiple sclerosis over the last decades that I've been practicing medicine. Rutgers published a study in 2010. That's 15 years ago. And he said, this study stated, we propose here that fungal toxins are the underlying cause of multiple sclerosis. And yes, folks, if you get rid of the mold that is making the mycotoxins, you treat the patient, they're back and well again. So gliotoxin has been shown to affect these three types of brain cells called microglia, astrocytes, and oligodendrocytes. So it's a neurotoxin, it's a toxin to the brain. Do not use glutathione for any kind of treatment when you have gliotoxin, because it'll make gliotoxin more toxic. You can read about it in this journal. And here's another point about gliotoxin and Parkinson's disease. This study published 4 years ago shows that glutathione is associated with the pathophysiology, meaning how Parkinson's disease develops. So be very careful about taking glutathione, especially if you're over 50. Hashimoto's, which is an autoimmune disease. Millions of people struggle with Hashimoto's, an autoimmune thyroid disease. They eat normal amounts of food, exercise, yet keep gaining weight. Their thyroid levels are difficult to treat and balance out. That's because the cause is the mycotoxins, not the thyroid. Once treatment for the mycotoxins is complete, the Hashimoto's goes away. And this was published in this study that you see in front of you. Here's another one. The patient presented with a normal function of thyroid or treatment for thyroid, okay? Once the treatment for mycotoxins was complete, normal thyroid function returned. Here's rheumatoid arthritis, another autoimmune disease. These two mycotoxins, deoxynivalenol and ochratoxin, make you more susceptible to develop rheumatoid arthritis. They increased the severity of rheumatoid arthritis in patients who already had arthritis, and they elevated these two IL-1 beta and IL-6, which are inflammatory parts of the immune system, and these were found in inflamed joints. So here's a gentleman, look at his ring finger. You can see the rheumatoid arthritis, look at his skin psoriasis. This is psoriatic arthritis. You see his abdomen and chest and his finger again. You can see the rheumatoid arthritis, how swollen it is. He was treated with creams and medications, immune suppressants for years, more than 10 years, till he came to see me. I treated him for mycotoxins after doing the test with MyMycoLab. Here's after 2 months of treatment. You can see it's fading away already, and here's after 6 months. He's clear. and he's fine. Here's a lady, and her son is a well-known and famous doctor in the United States, and he sent me this photo and said, "Can you help my mom?" I said, yes. I did the test on her from MyMycoLab, treated her, and here is, she took these pictures herself, the before and the after. You can see it's completely healed. How about SIBO? Here's a young woman, 30 years old approximately. This is pre-treatment, June 10th, 2021, and 3 months later, September 12th, 2021, look at her. You can see how the right treatment, the correct treatment, makes these go away. So let me talk about antibodies, because that's what we test for. We don't test for the actual mycotoxin, you test for the antibodies. There's 4 categories of what we call pathogens. These are bacteria, viruses, fungi, molds, and parasites. We develop antibodies to these after we get infected. And these 4 are living organisms that have cell walls. You know that, bacteria, viruses, etc. And antibodies to these mean past exposure. Toxins are molecules. They're not alive. They don't have cell walls. Mercury is not alive. It's a molecule. Glyphosate is a molecule. Arsenic is a molecule. Mycotoxins are molecules. Antibodies to toxins indicate that currently in your body, there's an immune reaction going on to these, that you have them in your body now. Once the toxins are gone from the body, in about 6 months of the correct treatment, okay, well, here we go. The antibody reaction fades away. Lyme disease. Well, Lyme disease and mycotoxins, because they confuse. People go to the doctor, say, I'm tired, I've got brain fog, I've got joint aches and pains, I've got all these problems. Oh, let's test you for Lyme. Well, it's not Lyme, it's mycotoxins. And this article was published in 2019, has been proven again and again to be correct. So let me tell you about what happened in Germany. There are 29 members of this interdisciplinary guideline group. This consensus committee consists of delegates of 19 medical scientific specialty societies, all of which are members of the Societies of Association of Scientific Medical Societies in Germany. Okay, that means like the head of cardiology of Germany, the head of obstetrics in Germany, the head of neurology in Germany, etc., as well as the Paul Ehrlich Society, the Robert Koch Institute, and the German Borreliosis Society, and 3 patient organizations. Borrelia is what causes Lyme. What did they find? A panel of 5 expert scientists, including one representative each from Austria and Switzerland, all of whom had been co-authors of guideline on Lyme brain disease, when Lyme infects the brain, served as in an advisory capacity. One thing they found is both IgG and IgM antibodies can persist several years despite a clinically healed infection. So you go back to your doctor, repeats the test, oh, you're still positive. Well, folks, no, you're not. Thus, they checked for a risk-benefit analysis, and there was no scientifically supported reason to change the recommendation of 2 to 3 weeks of antibiotics for the treatment of the typical patient with chronic Lyme. 3 weeks, folks, not 3 months, not 6 months, not 1 or 2 years, etc. So what did they say? They said that the benefits from patients with taking antibiotics with persistent non-specific symptoms after a correct or incorrect diagnosis of chronic Lyme disease, okay, was studied. They looked at, do those antibiotics help beyond the 3 weeks? No lasting improvement was found in any trial. No benefit was found with respect to either two endpoints, fatigue and quality of life. It did not change anything, although these patients kept getting treated for mycotoxins. Two clinical trials in Europe of antibiotic drugs established that only 2 out of 244 patients had treatment failure past 3 weeks. So the findings from all these studies are substantiated by 5 clinical trials in the United States and Europe that failed to show any improvement of this chronic Lyme with additional antibiotic therapy. And beside that, you can find antibodies to Lyme in 5 to 20% of normal people, depending on the area and age group. So here's the problem with Lyme disease. There's over 5 million Lyme tests ordered every year. They're ordered with very low positive predicting value. The doctor is just knee-jerking. Many tests are ordered for patients with chronic fatigue or fibromyalgia, etc. They might have a positive Lyme test, but it's due to cross-reactivity from other infections or inflammatory diseases, or even previously treated Lyme. So many clinicians look at co-infections with Babesia, Bartonella, etc., but fail to look for mycotoxins. And this was published 10 years ago, folks. So this is the diagnostic test for Lyme disease. This is the unsuitable test. The PCR test is not a suitable test. That means that Vibrant is not a suitable test. You can see the fourth one, that's the second one. The fourth one is enzyme-linked immunospot assay, the ELISpot. That's the Igenix one. None of these is acceptable. They're unsuitable. And the CD57, same story. So the VCS, or the visual contrast, that's unsuitable. All these are no good tests. A very common mistake I see regularly when patients come to see me: healthcare practitioners who treat the lab results but not the patient. And this is true especially for Bartonella, Babesia, and chronic Lyme. Why? Because if you have the right diagnosis and the right treatment, the patient gets well. The wrong diagnosis or the wrong treatment, patient gets years of treatment and they are still continue to be sick. I wanted to show you this. This was a study done on HVAC and refrigerators in homes, since these tend to have get wet, humid, and grow molds. Look at the last column on the right, trichothecenes. That includes Arternaria, that includes Stachybotrys, several different kinds of mycotoxins. They found all of these. What about the middle one? Ochratoxin A, and about 4. Aflatoxin, none, because aflatoxin doesn't grow indoors. What is the most precise and accurate test for mycotoxins for both toxic reaction, IgG, and mast cell activation, IgE? 14 different mycotoxins, MyMycoLab. And of course, it's available internationally. So what do the latest studies show about testing via blood or testing via urine? The ELISA method to detect mycotoxins in human serum comes with significant accuracy, precision, and specificity. This was published 3 years ago. And what do they say about urine? The variability of mycotoxin concentration in urine and its volume is based on daily intake. What you eat demands urine sampling at different time points during the day. And even so, it's difficult because various factors, such as are you male or female, how old are you, your diet, do you have a lot of muscles, are you very lean or what, can influence creatinine secretion. That's why it's a very urine testing is very inexact. Here's artificial intelligence from Google. Urine test for mycotoxins measure levels of mold metabolites. They don't measure the mold mycotoxins, they measure the metabolites to assess potential exposure. It is important to note that CDC and FDA do not endorse these tests for clinical diagnosis. So if you want a diagnosis, don't use urine testing. Blood serum antibody testing is considered more accurate for detecting mycotoxin exposure, as published studies have shown urine testing to be invalid. And what does this say about the CDC? What do they say? Use of invalidated urine mycotoxin tests. So here's a study that was just published in April. It showed that 80% of the time urine testing is inaccurate. And then, of course, here's this published material showing that these organic acid tests, the OAT test, claim to detect imbalances in gut bacteria and molds, but most of these tests do not measure what they claim to be. So look for the body burden of chemicals and mycotoxins in blood, not something that's left the body. What is in the body counts, not what's left. Okay. And here's a stool test that's pretty popular, the GI map down on the right. You realize that it's only specific 26% of the time. That means 74% of the time it is wrong. So this was published 5 years ago. What about treatment? First and foremost, the first rule of toxicology, get the patient away from the toxin or the toxin away from the patient. And second, you've got to build back the immune system and take an antifungal medication. How do you treat this? No matter how you treat it, the patient can no longer be exposed to molds and mycotoxins indoors. And remember, folks, the testing for indoor molds by inspectors, that is all an unregulated industry. So mold inspection is not regulated by anyone. You and I can take a course this coming weekend, and in 2 days we get a certificate. We take the course online, get a certificate, and we're mold inspectors. So let's talk about treatment. 80% of the immune system is in the gut. So this is where you begin. So the main components will be diet, supplements, vitamins, and probiotics. So you use spore-forming bacilli for probiotics, and you should go on a gluten-free diet for 90 days and avoid dairy, sugar, and soy. Why soy? Because in the United States, all crops of soy get full of a product that is known to cause cancer. That's Roundup glyphosate. What about the safety of this Itraconazole? If you listen to Facebook, Dr. Facebook or Dr. Google, oh, your eyeballs are going to fall out, your teeth are going to fall out, your liver is going to fry, all kinds of problems are going to happen to you. Well, I'm here to tell you that that is not medical evidence. Here's the medical evidence. It's a broad spectrum antifungal, favorable pharmacodynamic and pharmacokinetic profiles. It's available both oral and IV formulation. It's been proven to be a valuable addition to the antifungal drugs currently available for treatment. It has been well tolerated with up to 400 milligrams per day, generally free of serious adverse effects. Here's another study. It's a common antifungal that was developed in the 1980s, been clinical use for 35 years, with an established safety record. Let's take the other one, Itraconazole. And this is a study that was published 4 years ago in critically ill patients with acute on chronic liver failure and continuous renal replacement therapy. These people's liver and kidneys are failing. They had no problems in taking this. It also kills cancers. This is a forehead of a gentleman on the left, two pictures. You can see that cancer growing. It looks mean and nasty. Look at Itraconazole after 59 days of treatment. You can see the difference. Let's take a look at fluconazole and itraconazole. Well, Candida is a yeast. It's a single cell mold. All the others are multiple cell molds. Candida is a classical opportunistic infection, harmlessly in about 50% of people, kept in check by the immune system. It prevents Candida, has no activity against molds. So here's what you see. Aspergillus, Stachybotrys, Penicillium, Cladosporium, Fusarium are multicellular molds. Yeasts, baker's yeast, brewer's yeast, Candida are single cell. Fluconazole only works in single cell. It doesn't work in multiple cell. So let's look at a few supplements that I always tell people that these help you. This was published 10 years ago. The effectiveness of phosphatidylserine, is known as PS, has been studied in double-blind, placebo-controlled, randomized clinical trials. That is the gold standard for trying any kind of a thing, in medication or supplement or vitamin. It enriches myelin. It influences the metabolism of neurotransmitters like acetylcholine, norepinephrine, serotonin, which is our happy neurotransmitter, and dopamine. It stimulates enhanced performance that tests learning ability and short-term memory. Compared to the effects of placebo, which was ineffective, phosphatidylserine supplementation produced significant improvements in short-term recall, immediate memory, vocabulary skills, and ability to recall words, attention, and vigilance. So let's look at melatonin. And I have many of these studies. These are just a few that I'm going to giving you tonight. And this shows you the benefits. It reduces the cellular damage generated because of toxic substances. These protective effects are apparent when melatonin is given as a sole therapy or in conjunction with others. So melatonin's ability to protect nerve cells, neurons, from molecular damage due to a wide variety of substances, including mycotoxins. Let's look at magnesium. It's the 11th most common element in the human body. It's a master mineral necessary for 350 enzyme systems. So it plays a role in the majority of the body's metabolic processes. Up to 80% of the population is deficient in magnesium. And magnesium binding sites have been detected on more than 3,500 human proteins that are essential for building, repairing, and maintaining your body's health. This was published, it was a study I published in a medical journal. Here's B complex. B vitamins, there are 8 of them, and they're water soluble. Their collective effects, all of them together, are particularly prevalent to numerous aspects of brain function, including energy production, DNA and RNA synthesis or repair, genomic and non-genomic methylation, and the synthesis of numerous neurochemicals and signaling molecules. Furthermore, evidence from human research, not rats, clearly shows both that significant proportion of the population of developed countries suffers from deficiencies or insufficiencies in one or more of this group of vitamins. And that in the absence of an optimal diet, the administration of the entire vitamin B group rather than small parts, be this, be that, at doses in excess of the current government recommendation would be a rational approach for preserving brain health. Let's look at vitamin D3. It's very helpful in cognitive impairment, meaning you're starting to have memory lapses, vascular dementia, Lewy body dementia, and other conditions that develop due to brain cell malfunction or cell death. Low vitamin D3 are associated with an increase in cognitive impairment, such as is found in Alzheimer's disease, Parkinson's disease, etc., diabetes, cardiovascular diseases, cancer, and respiratory diseases. But let's talk about supplements. A recent study found that 11% of nearly 60 tested dietary supplements contain an accurate amount of the key ingredients listed on the label, and that 40% didn't have anything in the bottle that was on the label itself. 40%. So when you get them from this or that place, you don't know what you're getting. 2 more studies have come out, and this was an analysis of 40 dietary supplements. They looked for lead, arsenic, mercury, cadmium, or pesticides and found at least one of these in 93% of these supplements. And in botanicals, the second part here, the study of reported botanical supplements, meaning from plants, contained plant species not listed on the label. And active ingredient substitution was observed in among 83% of the companies tested. So folks, this is why I recommend detoxpure.com. This is what I did. I had someone from my staff order the box with all the necessary vitamins for treating molds and mycotoxins, and I sent them to a lab to check for heavy metals, to check for insect parts, to check for pesticides, and it was found to have 100% pure. I have nothing to do with these folks, but I can tell you that I'm alleviated to know that there's at least one place I can recommend to my patients that doesn't have what I just showed you on the previous slides. And here's a lady, she's the wife of a dentist. You can see her in October 2024 with Alzheimer's. She had positive mycotoxins from MyMycoLab in her blood. She took the treatment with the right treatment, Itraconazole, and the 8 specific vitamins and supplements at specific doses as studies show. And look at her 6 months later. She didn't want her eyes to be blacked out because she wanted to show people that it is possible. What do studies on binders show? Well, they think that you're being told if you take binders, it takes it absorbs mycotoxins from the gut. The kaolinite, clays, activated charcoal, zeolite, bentonite, etc. They're effective in neutralizing aflatoxin. And if you remember the slide I showed you before, aflatoxin does not exist indoors. They are ineffective in all other mycotoxins, and in addition, they also bind vital vitamins as well as macro and micro elements. This is a study published. Now, here's our sham or not helpful. Neuroquant. This is a test for brain atrophy, meaning Alzheimer and brain trauma, such as if you fell off a motorcycle and stuff like that. SPECT scan of the brain is much more useful in clinical medicine. Marcons, there's no evidence in medicine that this exists even, and it's not recognized by medicine or science. Other tests, MSH, C3A, C4A, there's nothing ever published in the 120 million studies in the National Library of Medicine under PubMed.gov that show any of these have anything to do with molds and mycotoxins. What about the HLA-DR test, genetic test? They claim that this affects 25% of the population of the United States. Well, that means it's about 82 million Americans who are supposed to be affected. But there isn't a single study that shows HLA-DR to have anything with molds or mycotoxins. No research. It's not taught anywhere. It has no basis in medical science. But let me ask you something. There's another disease that affects 34 million Americans, almost 50 million less than this fake HLA-DR. And you know it, it's called diabetes. So that's the hokey pokey that's out there on these tests. And folks, look at the date on the lower right-hand corner. ERMI, public may be making indoor mold cleanup decision based on this, developed only for research applications. And they said, don't use it. Here's what a healthcare practitioner wrote to me. I've never had the desire to study treatment for mold because the treatment and testing out there from Shoemaker, etc., those other, Nathan, etc., have never convinced me. In my 9 years of practice, I've never really seen a patient go through that style of treatment and come out on the other side feeling better. I've been watching your videos on YouTube, and I'm excited to get rolling treatment a few patients with your paradigm. Here's a patient. I've watched most of Dr. Campbell's webinars on MyMycoLab website 3 times each. I'm a health coach and was working for a US group that had a Shoemaker mold protocol, which was useless. I stopped health coaching at that program and focused on mold remediation in people's homes, as I think so many of my sick clients had mold in their homes without realizing it. Yes. And lastly, here's another healthcare provider. I'm a healthcare provider. I've recently come across MyMycoLab's information. Thank you so much for the help you provide. I do really appreciate all the great information on the website, especially the YouTube videos. Knowing that my own family has been exposed, we are all just recently had our blood serum tested and are waiting on those results. As someone who previously tried the holistic route, I can say for certain it does not work. So all those herbal treatments, etc., that it does not work. Here's my email address, and here are several studies I've published. I've published over 100. I'm just putting 5 of them here. The brain and mycotoxins, Lyme disease and mycotoxins, molds, mycotoxins, they're affecting children, mycotoxins, the brain, the gut, and misconceptions, and environmental triggers and autoimmunity. So next week, it'll be a webinar with Dr. Tissier, who's a real mold expert, and we're going to go talk about all the different types of diseases together on that webinar. It's coming July 2nd, a week from now. So folks, that's it for tonight. Let me look at your questions. I hope your questions are about what I just showed and not about something else. Okay. So, hello, Dr. Campbell. Any opinion on ozone? It doesn't do anything for molds or mycotoxins. About killing mold in homes, it would have to be at a very, very high concentration. Would receiving Itraconazole, Sporanox via IV be more effective than the oral? It depends on each person, how severe it is, what's your age, what are you, male or female? Do you have any other kind of medical problems? Are you diabetic, or do you have high blood pressure, et cetera, et cetera? It's not a general statement. Just really start on, is it normal to feel worse before you feel better? You only feel worse if you're still in a moldy place. And it could be not only your home, it could not be your home, it could be your car, it could be the gym where you go, or it could be at work, or somewhere you go on a regular basis. And that's common to feel worse if you're still being exposed. So let me put this on. I think there's more questions here. Person has been on your protocol for 3 months and starts feeling poorly. Again, finds mold at home once again after they've remediated again. Does the 6 months start all over? Probably yes. Can a person become resistant to Itraconazole? No. I have 2 clinics, one in Lausanne, Switzerland, and one in Guadalajara. Do they offer IV Sporanox? I don't need it because the oral form works just as good. And both places are accepting patients. I was educated in Lausanne, Switzerland, which is why I have clinic there, and then Guadalajara, Mexico, because people can't, it's much more affordable. Do you expect the levels to clear completely, or either almost completely or completely? I feel living in Florida doesn't help me with my recovery. Well, let me explain to you. It has nothing to do with weather. There's people with positive mycotoxins in Phoenix, Arizona, where it's desert, cactus and stones and sand. There's patients I have in Dubai, which is when you leave the city, it's pure desert. There's no humidity. It is due to poor construction, and inside the home, there's a leak. It's not humidity outdoors. Should you do liver function tests? You should test before and every couple of months while on Sporanox. Are there ways to reverse the effects of taking glutathione for 3 months orally or IV, which caused my daughter to go into a gliotoxin-induced cytotoxicity and her experience catatonia effect? Yes, I'm so sorry, because that's what happens with patients who are given the wrong thing because the doctor didn't know better. How do you explain being treated for Lyme and then had PCR tests? They found the actual Lyme bacteria then, because the studies show that PCR is not an acceptable way. If they found it in your blood, ask that lab, how come if published studies show PCR is not an accepted test? So I read a lot of your studies, do not see anything with controlled showing test results, high level of IgG and Ig after 6 months and then 12 months during the pre-plan. I'm sorry, but after I have 100 studies, did you read all of them? I don't think so. So those studies are published and you can find them in the National Library of Medicine. Treatment protocol with Itraconazole had some really hefty exposure to zearalenone and vomitoxin. Zearalenone is a very strongly estrogenic mycotoxin, so it's going to cause a lot of hormonal menstrual issues. Anxiety will get better, yes, more regular bleeding, etc. Yes, you've been, however, noticing some discomfort in my forearms that I've never felt before. Are you taking the correct supplements from the correct place? Also, you have to be on a low inflammatory, low histamine nutritional diet. Does granuloma annulare have anything to do with it? It can. Stacy, I had at the very beginning, Derm just said it was granuloma, which basically says unknown reason. No one could help me. Started taking 5,000 milligrams vitamin C, and it started going away, felt better. And come late spring, as the HVAC got worse, well, yes. So again, mold and mycotoxins. So there's a lot of problems with air conditioning systems because people really don't maintain them. There's no maintenance or very little. I want to try Dr. Campbell's program, but I'm afraid the antifungals for 6 months, etc. Okay, well, then you're going to stay ill, maybe? What is the alternative? What about eating organic poultry that is fed organic soy? I don't know of any place in the United States that has organic soy and this is why soy is sometimes mixed organic and inorganic and commercial. And again, I don't want anybody to have any Roundup in their body. Does high IgE contraindicate Itraconazole? No. Have you ever seen mycotoxins cause lupus? I've seen it cause lupus, Addison's disease, Cushing's disease, Hashimoto's disease, rheumatoid arthritis, etc. All the autoimmune diseases. My NA lab is positive. I might have lupus. That's correct. That's correct, because that's what mycotoxins can do. If you remember in the very beginning, I talked about autoimmunity. What if intolerant to complete B react to the thiamine? Did you use the right kind? Did you get the right kind from Detox Pure, or did you get it from some other source? I've taken high levels of supplements the past 5 years. Now there are reputable apps by many functional docs where traditional docs went to IFM route, training at root cause. Many recommend app, etc. Okay, so all I can tell you is what I show in published studies, not from opinions. In medical school, I was taught, in God we trust, everyone else has to show data. I'm not a person, I'm a medical doctor and I know about the human body. I don't know about homes and testing. I did 2 videos with Bradley May, a building engineer, that went through all the different types of mold inspection. You should see those, watch those, they're on YouTube. How long after cleaning my home should I start to see IgG and IgEs decline? They won't decline on themselves. These are toxins, they're molecules. They don't just automatically leave the body. You can move to the other side of the world. You can move to New Zealand. They're still going to be in you. So is mercury or heavy metals or any other toxins. Do you think the anti-cancer effect is related to the presence of fungi? That's what doctors and oncologists are now saying. What does it mean when your Ig is extremely low, but you have high IgG antibodies? Well, that means that you are basically colonized. Cholestyramine doesn't do anything. This is BS. That's the shoemaker BS, all that stuff about bile. And it's, yes, Sporanox is usually taken for 6 months. In medical books, it says 12 to 18. But if you take the supplements and do the diet and get away from the mold, 6 months. Are there any ways to reverse the effects of glutathione and gliotoxin? Yes, get on the treatment right away and stop taking glutathione. What type of doctor can prescribe itraconazole? The type that has a prescribing authority, meaning I'm an MD, medical doctor. I know doctors of osteopathy can do it as well. It depends on what state you're in, but all states except MD and DO prescriptions. I began noticing improvement after 2 months of taking Itraconazole twice a day. However, my prescribing doctor ordered an Itraconazole trough, which revealed I was not at all high enough dosage. It was increased to 300 milligrams. I've been feeling awful. Nowhere have I seen a study saying you should increase it because there's troughs. Your doc, it's not. Doesn't sound right to begin with. Okay, folks, join us, Dr. Tissia and I, next week. We're going to go through various diseases caused by toxic molds and their mycotoxins. We're going to talk about treatments. We're going to talk about all those things, what's worked, what has not worked, and what patients can do. And what these are all about, people and patients. So, folks, I hope to see you next week, same time, the same place. God bless you all. Take care. You're very welcome. Thank you.